Today, we're tackling one of the toughest, most sensitive scenarios you can face in your PLAB 2 exam, a colleague concern. So, let's get straight into it.
Welcome to this clinical walkthrough on the colleague concern case for UKMLA brought to you by Mediate, your 24/7 practice partner. Our focus today is all about showing true professionalism and empathy when a colleague is struggling, while still fulfilling your primary duty, which is, of course, protecting patients.
Okay, so let's set the scene. You're in your PLAB 2 exam. You notice a junior colleague. They seem a little off, maybe stressed, and then you smell it. Alcohol on their breath. So what is your professional duty in that exact moment? This station isn't really testing your medical knowledge, it's testing your professional judgment right when the pressure is on.
So what is the examiner really looking for here? They're assessing your professionalism and whether you can apply those core principles when things get difficult.
Now, your goal here is not to investigate or discipline. That's not your job. It's to respond with empathy, to offer support, and to communicate clearly. All while making sure patient safety remains the absolute #1 priority. This is the standard the GMC and the NHS will hold you to.
To handle this well, your entire approach needs to be anchored in these principles. You have to maintain a professional, non-judgmental tone. Address the concern directly, but do it sensitively, and really try to understand the why behind it. And above all, every single action you take must circle back to one thing: patient safety.
I know what you're thinking. That's a lot to juggle in a high-stakes exam situation. So how do you actually structure your response? Well, we're going to use a simple but really powerful tool called the support framework.
This acronym gives you a clear roadmap for the entire conversation, and it makes sure you hit every key point the examiner is looking for. So let's break down each step.
First up is S for set the stage. You just can't launch into a conversation this heavy. Your first 30 seconds are all about creating a safe, private space and just setting a respectful tone.
An opener just like this is perfect. It's warm, it's professional, and it immediately establishes some rapport. It frames you as a concerned colleague, not a manager, and that open-ended question invites them to talk first.
Next up is U for understand their side. Once that door is open, you need to raise the actual concern, but the key is how you phrase it. You have to use neutral language to state an observation, not make an accusation.
Notice the phrasing here. "I've noticed" is just a simple observation, and "I just wanted to check in" shows genuine concern, not judgment. This is so powerful because it invites them to share their perspective first. The critical rule here is to listen before you speak.
Once they've responded, we move on to the first P, probe the underlying causes. A problem like this is often just a symptom of a much deeper issue. This is your chance to show real empathy and professional insight by gently exploring what might be going on beneath the surface.
These kinds of open-ended questions are really effective because they aren't intrusive, they're invitations to talk. By asking about pressure, well-being, or outside factors, you're demonstrating true professional maturity. You're showing that you see them as a whole person, not just the immediate problem.
So after listening with empathy comes the second P, provide perspective. This is where you gently but clearly connect the situation to your shared professional duty. Remember, the goal isn't to scold. It's to reframe the issue around the one thing that matters most: patient safety.
This is a perfect example. The statement is factual and it's non-personal. By explaining why it's a concern, you shift the focus from a personal failing to a professional responsibility that you both share, which is a key principle in the GMC's guidance.
Mastering this kind of conversation really takes practice. You know, it's one thing to know the steps, but it's another to perform them smoothly under pressure. If you want to build that confidence, you can practice this exact case right now and get objective feedback on mymediate.com.
All right, after explaining the why, you pivot to the how. And this brings us to O for offer supportive solutions. Having identified a problem, you now need to be part of the solution. This is a critical shift from concern to support. This phrasing is just excellent. It normalizes seeking help, and it offers concrete, appropriate next steps. By mentioning specific resources, like occupational health, you show that you understand the support systems that are available, and you're genuinely trying to help them find a path forward. Next is R, for reassure. A conversation like this can feel devastating for your colleague, so it's vital that you reinforce their value and frame this moment not as a judgment, but as a potential turning point.
This is such a powerful way to close this part of the conversation. You're validating their honesty, you're separating this single issue from their identity as a doctor, and you're empowering them by framing support as the right choice. This demonstrates immense compassion.
Finally, T stands for take it forward together. You just can't leave this conversation with vague promises. You have to close the loop with a concrete shared plan of action. The question is, what happens next?
This is the perfect way to conclude. You clearly summarize the next steps, and then you check for their agreement. That simple question, does that sound okay to you, is critical. It ensures they feel involved in the solution, not like something is just being done to them.
So let's just recap that support framework one more time. You set the stage to build rapport. You seek to understand by asking, not assuming. You probe for causes with empathy. Then you provide perspective by linking it back to your professional duty. Finally, you offer real solutions, reassure them that seeking help is a strength, and agree to take it forward together with a concrete plan.
Ultimately, how you handle these situations says just as much about your fitness to practice as any clinical diagnosis you make. It proves you understand that the foundation of being a good doctor is supporting your colleagues to ensure every single patient is safe. So before your exam, ask yourself, are you ready to have this conversation? You can practice this exact case now on mymediate.com.